explain to our audience what exactly a water fast is. What happens? How long is it?
So water fasting is the complete abstinence of all substances except water in an environment of complete rest. And medically supervised fasting implies that a person's had a proper medical history exam and that there's appropriate laboratory monitoring that's done. At our clinic, patients are examined twice a day by staff doctors, and we've done this for 36 years. We've had 20,000 subjects successfully complete this process. And as I said, in our safety study, we were able to demonstrate that it can be done safely. So it is no question. If this or any other procedure isn't done appropriately, you can have negative outcomes.
Okay, good.
If it's done properly, it is a safe process.
Okay, and you recommend a 30-day fast period of time, correct?
Well, the periods will range depending on the patient and their condition from anywhere from a few days to a few weeks. It's unusual to go 30 days. That would be a small percentage of the population that would need to do that. Most patients that fast at the True North Health Center are fasting from periods of 1 to 3 weeks.
You have to be really smart about who you choose to do this type of fast. And so what are some of the criteria that you would use to see if this is an appropriate measure for a particular patient?
Right. So the first thing is reviewing the medical history in detail. There's a number of conditions and a number of patients that would not be good candidates for fasting. And there's certain conditions that are excellent candidates. Again, the conditions that respond the best are the conditions that are actually caused by dietary excess. So if you look at the study we published in high blood pressure, we have the largest effects that have been shown in treating high blood pressure in humans. 174 consecutive patients with high blood pressure, 174 people are able to achieve normal blood pressure without the need for medication. The challenge is that you have to continue to be willing to eat a healthy diet, live a healthy lifestyle in order to maintain the results. You know, fasting is not a magic cure. It's just a way to create an environment where the body can more rapidly heal itself.
Yeah, well, I look at it, you know, as hitting the reset button, right? I mean, you go on this fast. If you're fortunate enough to have these kind of positive results, the question then becomes, what happens afterward? Because there are phenomenons like rebound feeding, you know, where people end up having problems when they reintroduce foods into their diet again.
There's no question refeeding syndrome is a very real problem anytime there's been prolonged deprivation, which is why in our clinic, it's not just the period of fasting that's supervised, but a period of at least half the length of the fast refeeding. And we've been able to do 20,000 patients without seeing refeeding syndrome or other consequences of a negative consequence. So we know it can be done safely, but you're right, it does need to be done in a medically supervised setting.
Well, you actually have had some success, you say, with lymphoma with prolonged fasting. Tell me about that.
Well, we noticed that patients with lymphoma also appear to have positive effects, and so we began to very carefully document this. And in fact, one of our cases was published in the British Medical Journal case reports, where we took a patient that was a 42-year-old woman with a 2-year history of progressive lymphoma. She underwent 21 days of water-only fasting, resolved her lymphoma, and we were able to demonstrate not only did she get short-term results, but we also published a follow-up 3-year report that's showing that she's been able to maintain those results. And that's following a whole plant food, SOS-free diet.
Well, for sure, in that particular case, if it was the prolonged fasting that cured her lymphoma, that is a great outcome. But it's only one, you know, it's a case study, it's a case report. Why not bigger, more robust studies so you have a large number of people? You know, it's got to be a real scientific study.
Absolutely. In order to do a clinical trial, though, you have to first establish that there's a rationale for it. And so we're publishing what we hope is a number of case reports with follow-up, and then we hope we'll be able to qualify to do a clinical trial. Right now, it's a question of educating both the public as well as the health professionals that fasting is a biological adaptation. It can be used effectively in certain situations. It does require appropriate monitoring, but it may turn out to be one of the most effective ways of giving the body a chance to heal itself from some of these conditions of dietary excess.